This is a case of a 47-year-old male patient who presented with intermittent generalized cramping abdominal pain, and sometimes the symptoms made him wake up at nights. The clinician wanted to rule out renal pathology, so CDKUB was performed for further evaluation. So these are the images. As for the kidneys, they look normal. There is no evidence of renal stones or hydronephrosis or hydroureter. No obvious pathology in the urinary bladder, although it's underfilled. But anyway, I carefully read the images for a pathology explaining the symptoms of the patient, and nothing was found but a generalized fecalization of the small bowel, the small intestine. So here is the large bowel, and in the middle there are several small bowel loops here and there, which show significant fecalization. Here, here, most importantly here. I will show you in coronal views and we will discuss this case. So in the periphery is the large bowel, the ascending colon, the descending colon, and all the rest is multiple small bowel loops which show significant fecalization. This finding is the most likely explanation of the patient's symptoms. In the recent years, many similar cases have been assigned to me for reading, and my impression is that this condition is quite common. That's why I present it to you. Fecalization of the small intestine has been recognized as a pathological entity, and it is related to the so-called SIBO, small intestine bacterial overgrowth, and this condition is associated with a kind of dysbiosis, that means disrupted bowel flora. So SIBO or SIBO. What is SIBO? As part of the introduction of this presentation, I would like to mention some basic knowledge. The human gastrointestinal microbiome is a major player in health, a far greater influence than anyone suspected. And small intestinal bacterial overgrowth, the SIBO, is the presence of excess colonic bacteria in the small bowel. Keep watching this video to explain you the symptoms, the recognized causes, the pathophysiology, and the complications of SIBO. The excess of these organisms, of the bacteria in the small bowel, result in multiple intestinal symptoms like abdominal pain, bloating, diarrhea, and sometimes malabsorption. The protective mechanisms against SIBO are the peristalsis and the normal gastrointestinal tract motility. The stomach with the acid, the bile duct producing the bile, the pancreas with the proteolytic digestive enzymes, and of course an intact ileocecal valve. When these protective mechanisms against excessive bacterial growth fail, small intestinal bacterial overgrowth can manifest. So, the symptoms now. When bacteria that are normally present in the large bowel start to grow in the small bowel, many symptoms can follow, and the most important are bloating, abdominal pain, excessive belching, reflux, excessive wind and flatus, alternating diarrhea and constipation as a symptom of irritable bowel syndrome, sometimes loss of appetite, nausea, unintentional weight loss, and sometimes malnutrition. As for the etiology, the causes, this is something complex. Some of the recognized causes are the following: reduced gastric acidity, for example from medications like proton pump inhibitors for gastric ulcers or gastroesophageal reflux, reduced motility of the gastrointestinal tract, age-related medications like opioids, irritable bowel syndrome, narcotic use, post-radiation enteropathy, diabetes, scleroderma. Another cause could be stasis of the bowels, like in several conditions like diverticulosis, bowel strictures, postoperative adhesions, gastric bypass, blind loops, and ileocecal resection. Some other causes can cause anatomical or post-operational changes like GI operations, excised ileocecal valve. Another cause is immunosuppression, because in this case low IgA, which is a barrier against the bacterial overgrowth, is very low. Gastric hypochloridria related to age, to proton pump inhibitor medications, stress, low zinc levels, gastric surgery. Another cause could be pancreatic insufficiency, because proteolytic enzymes digest and degrade bacteria, and some other metabolic and other systemic disorders. Some additional causes have also been proposed, like antibiotics overuse, antibiotic residues in dairy and meats, pesticides residues in products, and synthetic sweeteners. So this pathological entity, the SIBO, may be the end result of a long list of causes that includes all the above possible causes. Regarding the epidemiology, the most predominant cause of SIBO are irritable bowel syndrome, intestinal motility disorders, and chronic pancreatitis, which they account for 80 to 90% of cases. SIBO is more prevalent in the female population and in elderly individuals, as well as in aged patients. Regarding the pathophysiology, as a result of the large bowel microorganisms ascend up from the colon and colonize the ileum, the jejunum, and the duodenum, and the bacteria can produce enzymes or endotoxins which damage the epithelial cell layer of the small bowel, resulting in symptoms. As you can see in this image, we can see that there are some mural changes in the small bowel. There is some thickening, And apart from this, there is a generalized mild blurring of the mesentery. This is reactive. As for the complications, severe chronic small intestinal bacterial overgrowth can result in significant weight loss and severe malnutrition, leading to substantial morbidity and mortality. Early recognition of SIBO can treat the maldigestion of nutrients and prevent malnutrition. If this condition left untreated, can lead to intestinal failure. Finally, SIBO is considered by most clinicians as a differential diagnosis in patients with non-specific gastrointestinal complaints. And from the radiologist point of view, fecalization of the small bowel in the absence of other imaging findings can explain non-typical gastrointestinal tract symptoms. Dear friends, thank you for watching this video. See you the next time soon.